Imagine waking up one morning, reaching for the nightstand, and suddenly your hip gives out, or your vision goes blurry and doesn't come back, or the knee pain you've been brushing off for 2 years finally lands you in a surgeon's office. This isn't a worst-case scenario. For millions of Americans over 60, this is a Tuesday. Today, we're going to talk about the surgeries most likely to happen after 60, the ones your doctor may not bring up until it's almost too late, and more importantly, what you can do right now to lower your chances of ever needing one. Stay with me. This could genuinely change the rest of your life.
Here's something that surprises most people. According to data from the American College of Surgeons, adults over 65 account for nearly 40% of all surgical procedures performed in the United States every single year. That's not because older Americans are unlucky. It's because our bodies carry decades of wear, stress, and small decisions that silently add up. And the most common surgeries, the ones we're covering today, are almost always preventable, or at least delayable, if you know what's coming. So let's go through them one by one. Some of these will sound familiar. Others might shock you.
Let's start with the most common surgical procedure performed on adults over 60 in America. And it's one most people never see coming until the pain becomes unbearable. Joint replacement surgery. Specifically, hip and knee replacements. Every year, over 1 million Americans undergo joint replacement surgery. And the average age? Right around 65. The scary part isn't the surgery itself. It's what happens before it. Years of ignored pain. Mornings where getting out of bed feels like climbing a mountain. Stairs that used to be nothing, suddenly becoming a daily battle. Sound familiar? But here's the shocking part. Most joint surgeries don't happen because of one dramatic injury. They happen because of a slow, quiet process called cartilage breakdown, and it starts decades before you ever feel serious pain. Every time you've carried extra weight, skipped movement for years, or pushed through joint discomfort without treatment, you are unknowingly adding to a countdown clock. And once that cartilage is gone, it doesn't grow back. The good news? We'll get to what actually slows that clock down. But first, let's talk about the surgery most people are terrified to even say out loud.
Cataract surgery. Over 4 million Americans have it every year, making it the single most performed surgery in the entire country. And the overwhelming majority are over 60. Cataracts develop when the lens of your eye gradually clouds over, usually so slowly you barely notice, until one day the world just looks foggy. Colors fade, night driving becomes terrifying. You start holding menus farther and farther away. Most people assume this is just aging, and they wait, sometimes too long, because untreated cataracts don't just steal your vision, they steal your independence. They make falls more likely, they make reading impossible. They quietly pull you out of the life you've built.
And this is where it gets dangerous. Falls. The word sounds almost too simple for how devastating the consequences can be. Hip fractures from falls are one of the leading causes of surgical intervention and loss of independence in adults over 65. In fact, 1 in 4 Americans over 65 will experience a serious fall this year. And of those who undergo hip fracture surgery, up to 25% will not return to their pre-fall level of function. That's not meant to scare you into paralysis. It's meant to wake you up. Because most falls are preventable. And most of the conditions that cause them, poor balance, muscle weakness, vision problems, medication side effects, are things you can actually address right now.
Now, let's talk about something most people over 60 are quietly dealing with: heart surgery. Specifically, procedures like bypass surgery, valve repair, and stent placement. Coronary artery disease doesn't announce itself. It builds silently over years through diet, stress, inactivity, and genetics, until one day it's an emergency. About 800,000 Americans have a heart attack each year. The majority are over 60.
And while many of those events lead to surgical intervention, the most sobering truth is this. Many of those surgeries happen to people who thought they were doing fine, who walked every morning, who felt healthy. Heart disease is the definition of a silent threat.
So why does all of this converge after 60? It's not just age, it's accumulated time. Time spent under chronic stress, time with less than ideal nutrition, decades of inflammation quietly building in joints, arteries, and eyes. The body is remarkably resilient, but it keeps score. And after 60, that score starts to show up in doctors' offices and surgical suites across America. But, and this is the part most videos don't tell you, the body also remains remarkably responsive, even at 65, even at 72. The habits you build right now, today, can genuinely delay or prevent many of the surgeries we've talked about. Not tomorrow, today.
Let's also talk about spinal surgery, because it's more common after 60 than most people realize, and it's almost always preceded by years of warning signs that get dismissed. Spinal stenosis, herniated discs, and vertebral compression fractures affect tens of millions of older Americans. The early signs? Numbness in your legs when you walk, lower back pain that gets worse when you stand too long, a strange tingling in your feet that comes and goes. Most people chalk this up to just getting older, and by the time they take it seriously, they're looking at surgical options. Early intervention, physical therapy, targeted movement, anti-inflammatory nutrition can change the entire trajectory.
Before we get into exactly what you can do to protect yourself, and there's a lot you can do, if this video is opening your eyes, do me a quick favor and hit that like button. It helps more people over 60 find information like this who really need it. And if you haven't subscribed yet, now is a great time. We put out new videos every week on staying healthy, strong, and independent well into your 70s and beyond. Now, let's talk about what actually works. Here's what the research consistently shows about preventing or delaying the surgeries we talked about today. First, movement. Not marathons, not intense gym sessions, just consistent daily movement. Walking 30 minutes a day has been shown to reduce joint deterioration, improve heart health, and dramatically lower fall risk by strengthening the stabilizing muscles around your knees and hips. Second, nutrition. Specifically, foods that fight inflammation. Leafy greens, berries, fatty fish like salmon, turmeric, and olive oil aren't just healthy buzzwords. They actively reduce the chronic inflammation that accelerates cartilage breakdown, artery disease, and bone loss. Small changes at the dinner table today keep you out of the operating room tomorrow. Third, get your eyes checked every year. Cataracts caught early are treated quickly and safely. Delayed, they become a cascade of problems: falls, isolation, lost independence. Fourth, know your medications. Many common prescriptions, including blood pressure medications, sleep aids, and antihistamines, can affect balance and coordination. Talk to your doctor about your full medication list and ask directly, could any of these increase my fall risk? That one question could change everything. And fifth, take bone health seriously. Vitamin D, calcium, and resistance exercise aren't optional after 60. They're the infrastructure that keeps you standing. Literally. Here's the final truth I want to leave you with today. The surgeries we talked about, joint replacement, cataract surgery, heart procedures, spinal surgery, they are not inevitable. They are not simply what happens when you get older. They are the result of years of small choices, many of which can still be changed. You are not too old to make a difference in what the next 10 years of your life look like. The people who stay mobile, sharp, and independent into their 80s didn't just get lucky. They paid attention. They made adjustments. They refused to accept decline as the default story. that can be your story too.
If someone you love is over 60, share this video with them today. Not to alarm them, but because knowing this information is genuinely one of the most loving things you can give someone. Drop a comment below and tell us, which of these surprised you the most? We read every single one. And if you want to see our video on the 5 foods that protect your joints after 60, it's coming up next. You will not want to miss it. Take care of yourself. You've earned it. And we'll see you in the next one.